Jeff Hayes is the Policy and Campaigns Manager for the mental health charity Mind. Jeff, your reaction to Cathy's findings?
Well, obviously, it's shocking. When people go into hospital, because they're unwell, they expect to be treated with dignity and respect, and they expect to be safe. And they go there to get better. They don't go there to die. So it's really shocking that this is happening.
People might automatically think this is due to cuts under the age of austerity. But does it go back further than that, further than the past government or the previous one before that?
Yeah, and mental health services have been historically underfunded. We're trying to catch up. We've had some, over the last government, had a lot of positive policy initiatives, a lot of talk about achieving parity of esteem. But as this piece shows, there are still mental health services across the country, because this isn't unique, that are really stretched. They don't have the staff and resources, they don't have the number of beds to treat the increasing need.
Well, exactly. In just the last fortnight, there was a day when there was not a single available bed for a mental health patient anywhere in England. It really is a desperate situation. Apart from putting more money in, is there a change of attitude that needs to happen?
Yeah, I think the government and the NHS and Department of Health are listening. They're saying the right things in terms of really talking about the focus on crisis care. Last year we had the Crisis Care Concordat, which is a really great piece of work about getting every local area to be thinking about this and developing their plans to improve this in their local area. Clearly, in some places, that isn't enough at the moment. We need to just keep on pushing.
So, but there is, however, a little bit of light at the end of the tunnel. You're sensing that?
Yes, in terms of intention. The more people are talking about it, the better. Realising this is a really big problem. Historically, that didn't happen. People were ignoring it and didn't understand mental health. People are talking about it now. MPs in Parliament are talking about mental health.
Yes.
So with that, we get a greater focus. Hopefully, greater funding will follow, and we won't have this again.
The time is of the essence, clearly.
Definitely.